recorded to the cloud, but I don't. So hopefully it's been recorded
Now
if
it's
it's.
being recorded because
Oh
it just
God.
said this meeting is being recorded.
Oh God. Okay. I'm sorry. I seriously thought it was being recorded.
It said it twice earlier, like at the beginning it
Did
said it,
it?
and then when you pressed it earlier, I don't know when it's getting turned off, but it's earlier it had said it twice that it was being recorded.
Yeah, because I'm doing this at work, so my work desktop. So my one at home, like it usually says, in the corner that it has the record button. But yeah, I didn't see that this time, and it said twice that it was recording it to the cloud. So I don't exactly know what it's doing. But hopefully it recorded something. I apologize. I don't know why it looks different here. I thought I hit record and that when you said you could see it, that it was recording. Um, but I will try to do my best. I'm sorry about that. Um, but let me share my screen. Can you guys see this chapter 18?
Yes.
Yes.
Okay. So I'm not gonna like give you like obviously exactly what's in the test, but the information that we just went over, like on the test that we just went through that you took on Tuesday, you should still know that material. Does that make sense?
Yeah.
Okay.
Yeah.
We're building off of that. So you should still know um, for the adrenergic system right here, you should still know the neurotransmitters, that those are epinephrine and norepinephrine. All right. You should still know the receptors, that it's alpha and beta. You should still know everything that the sympathetic nervous system does to the body. And you should still know what it means to give you medication to turn them on, and then when I give you the blockers to block them so that they can't be turned on. Um, that should be the main of it.
That looks like it. You want to check before I pull her out? Ain't nothing on the door.
Okay. So that's kind of what all this information is. Okay. Does that make sense?
Yeah.
You
Um,
talking about this chapter?
yes. So you should know all of that information that we went over last time. Okay. That was just on the test that we just went over. Because you will see versions of that information again. Okay. Um, and then do you see all the drugs? The respiratory drugs, the nasal decongestion drugs, the eye drugs, the bladder drugs, the cardiovascular drugs. You should know both of these slides. Does that make
What
sense?
slides are those?
8 and 9. Chapter 18, 8 and 9. You should have these memorized. Okay. If you're going to memorize something, memorize these ones. Okay. And then this slide right here is going to be one of the most important. So slide 8, 9, and 10 are going to be the most important in chapter 18. Okay. I'm not saying that you don't need to know the rest, but the rest is kind of the information that we already went over. So knowing the contraindications, the interactions, and the adverse effects that we talked about for adrenergics, you should also know. Okay. And then again, the nursing implications, these are kind of just, I want to say they're common sense, but you should be familiar with these as well. Because again, they're just kind of like, what as a nurse do I need to monitor when I give these drugs? I should know my patient's baseline before I give them drugs that might affect their nervous system. Does this make sense?
Yes.
Okay. So if you're going to focus on chapter 18, do slides 8, 9, 10, and 11. Okay. 8, 9, 10, and 11. So the last four slides. Okay. Plus, make sure you know that intro, that basic chapter. Okay. Fair enough for 18? Can I go to 19?
You can go to 19.
Okay. 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 So you should be familiar with like this, right? That's kind of a part of the intro material. Um, and again, you should know that the alpha and beta blockers literally sit in front of the alpha receptors and the beta receptors on the heart and the lungs and make it so the sympathetic nervous system or sorry, and the rest of the body if they're the alpha receptors. So the sympathetic nervous system can't tell the body to do the things that the sympathetic nervous system does. Does that make sense? So you should know like that mechanism of action. It's literally making it so epinephrine and norepinephrine can't send these messages to the body. Okay. So again, that's kind of like what all of this is saying, or at least this slide right here. So these are the alpha blockers. I told you the biggest things to remember for the alpha blockers would be bladder and blood pressure. Okay, bladder and blood pressure. We just talked about the mechanism of action, so it's right here. Okay. The indications here, again, is to treat urinary retention or to treat hypertension. Okay, so that's all that this is saying. My contraindications, know this list. Know the interactions right here. Basically, the interactions that you need to know about is if you take two alpha blockers together, it's too much for my body. Okay. And I have a risk of hypotension. Does that make sense?
You said the alpha was bladder and blood pressure.
Blood pressure. Yeah. So if you take like two alpha, let's say you're taking an alpha blocker for your bladder, and then you're also taking an alpha blocker for your blood pressure. So like one patient is taking two different medications that are alpha blockers, they have a risk of getting hypotension, like severe hypotension, where they would like bottom out their blood pressure and collapse from like a syncope episode. Does that make sense?
Yes.
Okay, so that's more like the intervention or the interaction that I really just need you to know. And then the adverse effects here. So just know this list. All right. Because the alpha blocker side effects are a little bit different than the beta blocker.
Wasn't
And then,
this the slide where you told us to
yes,
memorize?
ma'am.
There was three drugs we had to memorize for the test. What were those three?
Yeah, that was
I
this one right here.
okay.
Yeah, so that was your mini press.
Which is used for hypertension?
Yep. And then you have your Flomax. So I wanted you to know this one. And then I wanted you to know the Cardura, which is also, I believe, used for blood pressure. So two blood pressure drugs and one urinary drug. Okay.
Thank you.
Yep, no problem. And then we just had the beta blockers. I know some of you may not be as familiar with beta blockers from last semester. Miss Neal was telling me about your Farm 1 experience. However, beta blockers, I kind of just told you what their mechanism of action are. They literally block the sympathetic nervous system from being able to simulate the heart. Does that make sense? So if I need to lower my heart rate, right, I'm stopping the sympathetic nervous system's ability to cause tachycardia. Okay.
So
Um,
only the heart, not the lungs.
Correct. Yes, you are correct. Everything that it does right here, forget the migraines, don't worry about that. But the everything that it's treating right here is a cardiac issue. Okay. Um, so it's treating angina. Because basically what it's doing is it's telling the sympathetic nervous system, don't make the heart work hard. Okay. Don't make the heart work hard. Don't irritate my heart. Okay. Because we know the sympathetic nervous system kind of like jolts things up, right? Um, so if I have heart failure, it would make sense that I don't want it to make my heart work harder, right? Because if it makes my heart work harder, then I'm going to make the heart failure worse, right? Because that's the whole point of heart failure is that your heart doesn't pump effectively. Um, if I have angina, all right, usually it's from an oxygen mismatch. My heart is not getting enough oxygen. So if it has to work harder, it's going to need more oxygen that it's not getting, causing chest pain. Um, and then with a dysrhythmia, right? It's going to stop my heart from going fast. It's going to stop one of those like fast dysrhythmias. And same with blood pressure. It's going to make the heart not have to push as hard against that resistance in the blood vessels that may be making it hard for the blood to go out. Does that make sense? So by slowing down the heart, by making it so the sympathetic nervous system is like, don't irritate me, I can treat these different conditions. Chest pain, dysrhythmia, heart failure, and hypertension. Okay. Does that make sense a little bit? Without going like super into like a whole beta blocker thing.
Yeah.
Okay. Um, so again, you do not take this though for severe heart failure. You only take it in early stage heart failure. So that's a contraindication. And then just know the rest of these contraindications. Okay. And then know that it interacts with sulfonylurea. Okay. It can cause hypoglycemia. And it can cause hypoglycemia because of this right here. One of its adverse effects is that it can cause a delay in my body to recover from a hypoglycemic episode. So if I'm a diabetic and I'm taking a medication like sulfonylureas that drop my blood pressure or blood sugar down, and I already have potential blood sugar issues from the beta blockers, do we see how that may be harmful to my diabetic patient?
Am I misunderstanding? So with the
Yes.
sulfonylurea and the beta blockers, I was under the impression, or maybe I'm confusing it with a different medication, that it can cause the hypoglycemia, but can it also mask the symptoms of hypoglycemia?
Yes, it can. Yes.
Okay.
So you are correct in both. Yes. So that's why it's like it may prevent you from recovering from it, but it also may prevent you from really knowing that you have it as well. Okay. And then that's why you see these adverse effects, right? We talked about the bronchoconstriction because we know that it can stop the sympathetic nervous system from telling the lungs to dilate. The thrombocytopenia, so low platelets. Bradycardia, because again, it could lower your heart rate too low. Fatigue, heart failure, because again, we don't want to take it in severe heart failure. All right. And then you don't want to stop taking this quickly because it can cause angina, MI, and hypertension. So you can almost get like rebound cardiac issues if you stop it too soon. Okay. And then here's just the name of all the beta blockers. I'm not going to, again, have you know the information in between, but just know that if you see LOL, 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 it's a beta blocker. Simple enough. So you don't even have to memorize them. As long as you know that beta blocker ends in LOL, you're good. Okay. And then just read through these nursing implications. Are we good for 19?
Yeah.
For 20, I do need you to be aware again of what the parasympathetic nervous system does. So all this stuff, or on that chart that I gave you. And then know that the neurotransmitter is acetylcholine. And then know that the receptors are muscarinic and nicotinic. All right. Um, and then I'm just trying to make sure. And know that the cholinergic medications kind of like cause more acetylcholine in the body to spread to be able to stimulate any of these things to turn them on. Does that make sense? We're good with that.
Say that part one more time.
The medication that I'm giving you for cholinergic medication is I'm basically giving you more acetylcholine or medication that's going to enhance acetylcholine because acetylcholine makes all of this work, right?
Right.
'Cause yeah, so I'm basically giving you more of it, or I'm giving you a medication that's going to make it work better so that I can turn this on. Okay. Does that make sense?
Yeah.
Okay. And again, this is just the same picture. It's just a different version of it. It is, in case you like this one better. Um, so this information right here is just telling you all of that. All right. So this slide right here, that's kind of like the other basic info slide. But these medications, so you need to know all of these medications and all of these medications. Okay. Um, so slide 5 and 6, very important. Okay. Um, and then the mechanism of action, I just told you that. So as long as you understand that, then you're good with this. Um, and then you should just make sure that you know this slide. Okay. Contraindications, why I shouldn't be taking these. Okay. Interactions and adverse effects. Okay. Because those are always important for every drug. And I'm always going to ask you questions about those. Okay. Um, and then this right here is really important. the cholinergic crisis, because now I have too much cholinergic medication in me. I have too much acetylcholine in my body. And make sure you just basically just know that I have too much acetylcholine and know this part right here. Okay. The early symptoms, which is sludge, and then the later symptoms, which is severe cardiac collapse. Okay. And then just know that I give atropine in the early stage and epinephrine in the late stage. Okay. Make sense? And then I'm not requiring you to know this. Don't worry about this one. And then just read through the nursing implications, okay? Because you may see those. Simple enough for 20?
Yeah.
Okay. And then 21 is a cholinergic blocker. So again, know that these medications literally sit in front of the nicotinic or the muscarinic receptors and make it hard for acetylcholine to even spread their message to those organs. Okay. So that would be the mechanism of action. Otherwise, everything is pretty much the same from the basic info material. These are your anticholinergics. Okay. Um, so that's just everything that that's telling you right here. Okay. And then you need to know this slide of all the drugs. Okay. So these are like all the things that they treat and how they treat them. Okay. Same with this, or so sorry. So you need to know 3. Okay. Slide 3 is very important. Slide 4, you really don't need to worry about as long as you understand the blocking process. Slide 5, you definitely need to know because, again, that's contraindications, interactions, and adverse effects. And then you just need to know the name of the drugs. So you need to know 6 and 7. Okay. And then you definitely need to just read through again the nursing implications. Okay. Does this help?
So these drugs basically do what the sympathetic.
Correct.
Okay.
Yep.
And it's the
Correct.
opposite
Yep.
with the sympathetic. Okay.
You are correct. Yep. And that was one of the things I wanted to uh, emphasize and
So,
to grasp. Yeah.
so just to get a clear understanding, the blocking drug is blocking the ACH from sending a message to the primary um organ so it can do its job.
Yep.
Okay. And
Yep.
that we'll see that in the Parkinson's patients, right? In the Alzheimer's, we will see the cholinergic drugs.
Um, yes. So the Parkinson drugs are the best at, so there are cholinergic, or sorry, anticholinergic Parkinson drugs. Okay.
Okay.
And then there are cholinergic, what is it? I
For
can't talk.
Alzheimer's.
Yes. Alzheimer's drugs. Yes.
Okay. Okay.
Yep.
I just want to make okay.
Yep.
Okay.
Yep. And that's why
All right.
Parkinson's is a contraindication for cholinergic drugs because you treat it with an anticholinergic.
Okay.
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 Yeah.
All
Perfect.
righty.
You got a good grasp there. All right.
Well, thank you so much. We
You're
appreciate
welcome.
you for taking your time out, and we'll see you next week.
All right. That sounds good. Any other questions, concerns? I think that was pretty much everything that we needed to go over.
Yes, thank you so much for this. It's been really helpful.
Okay. Perfect. Not a problem. That's what I'm here for. All right. So I will see you guys next week unless you decide to hop on Tuesday, but basically going to do the same exact thing on Tuesday. So if you want more of the same thing, I'm here. If not, you're good. And I will try to figure out what's going on with the recording. Okay.
Thank you.
All right. No problem. And I'll post the math and look at those questions. Okay.
Have a good day.
You too. Bye bye.